Here are 7 key facts about beetroot. 1 cup of beetroot contains 43 calories, 1.6 grams of protein, 9.6 grams of carbs, 6.8 grams of sugar, 2.8 grams of fiber, and 0.2 grams of fat. Beetroots help lower blood pressure. Beetroots are rich in organic nitrates, which helps cut risk of heart disease and strokes. Studies show that beetroots can reduce blood pressure by up to 3 to 10 millimeters. Beetroots helps increase exercise capacity. Studies suggest that nitrates enhance physical performance. Nitrates from beet juice help increase cardiorespiratory performance and improve muscle function. Nitrates open up your blood vessels, which increases blood flow and feeds oxygen to working muscle. A cup of beetroot could help you complete that extra kilometer in your morning jog. Beetroots has anti-cancer properties. The plant pigment that gives beetroot its color is betacetin, a powerful agent that helps suppress the development of some types of cancer, including bladder cancer. Beetroot increases the production of immune cells and body enzymes that help fight cancer development. Beetroots improve digestive health. Beetroots are rich in glutamine, an amino acid essential to the health and maintenance of our gut. They're also rich in fiber, which supports effective bowel function. Beetroot may affect urine and stool color. People may have red or black-colored stools after taking beet juice. Also, pink or red urine is common when eating more beet products. These are usual side effects and are not harmful to the body. Avoid beetroot if you have kidney problems. Patients with kidney problems or those at high risk of developing kidney stones should avoid beetroot. Beets are rich in oxalate and may contribute to stone formation. Those were the positives and some negatives about beetroot. Hope you enjoyed the video. Make sure you like, subscribe and share for more health content.
What are benefits of eating spinach? Why add spinach to your diet? Why do scientists class spinach as a superfood? Want to learn more? Keep watching and find out why you should be obsessed with spinach. Spinach is really good for your eyes. The antioxidants that are found in spinach are lutein and zeaxanthin. These help in providing good eyesight. It also protects your eyes from cataracts and other eye problems. Spinach could help prevent cancer. Spinach has a high source of zeaxanthin and carotenoids. These flush out the free radicals from your body. These free radicals make your body prone to diseases such as cancer. So all you need to do is to consume spinach and prevent yourself from stomach cancer, mouth cancer and esophagus cancer. Spinach curbs appetite. Spinach is rich in thylakoid. Studies suggest thylakoid may reduce your appetite. This happens because they lower levels of a hunger hormone. It also raises hormones that make you feel full. So if you have been looking for a way to reduce your calorie intake, spinach might be your solution. Spinach strengthens the immune system. Spinach is rich in vitamins and minerals like magnesium. These strengthen your immune system. A strong system keeps you safe from viruses and bacteria. It also defends your body from toxins. Acne is a common skin condition. It causes the pores of your skin to clog and begin to cause irritation and inflammation. If you have acne, try consuming spinach. This eases the inflammation in your skin. You can also prepare a facial mask by making spinach paste and adding water. Spinach helps prevent anemia. Iron deficiency anemia is a common health condition. It occurs when there is a lack of iron in the body. This leads to a reduction in the number of red blood cells. Symptoms include fatigue, increased heart rate, shortness of breath, headaches, and dizziness. Spinach has a high source of iron content. It helps to create hemoglobin, which brings oxygen to your body tissues. This can prevent you from the risks of developing anemia. Spinach can help with blood glucose management. It is high in fiber and nutrients such as magnesium and vitamin A. These nutrients can help lower blood sugar. Spinach has high potassium. Potassium reduces the effects of sodium in the body, making it a good food to choose if you are following a diabetic diet. Spinach aids fetal development. Spinach is rich in folate, a nutrient essential for fetal development. Folate is a B vitamin that is imperative to healthy infant development. It helps prevent serious defects of the spine and brain, which makes it one of the best foods to eat when pregnant. I recommend soon-to-be mothers to include spinach in their diet. Spinach is a muscle fuel. Researchers found that a compound in the vegetable increases protein synthesis by 120%. This helps your muscle tissue to repair itself faster after you work out. Overall, we learned from this video that spinach is a necessity for your diet. The benefits speak for itself. The true epitome of a superfood. However, depending on just this vegetable isn't a good idea. You need a variety of healthy foods in your diet as well. Find out more about them by watching more videos from our Health Habits channel. Make sure you like, subscribe, and share for more daily health content.
Welcome to Health Habits. Today, we will be talking about intermittent fasting. Intermittent fasting refers to alternating between fasting and eating on a regular schedule. Research shows that intermittent fasting is a way to manage your weight and aid weight loss. Many diets focus on what to eat, but intermittent fasting is all about when you eat. There are several different ways to do intermittent fasting. They are all based on choosing regular time periods to eat and fast. We will go through each method during this video. Disclaimer: restricting your calorie intake for an extended period of time could be dangerous. Do not partake in intermittent fasting if you are a child, pregnant, breastfeeding, or diabetic. Intermittent fasting method 1. Fasting for 12 hours. The rules for this diet are simple. A person needs to decide on a 12-hour fasting window every day. According to researchers, fasting for 10 to 16 hours can cause the body to turn its fat stores into energy. This releases ketones into the bloodstream, which encourages weight loss. 12-hour fasting plan may be a good option for beginners. This is because the fasting window is relatively small. Much of the fasting occurs during sleep. This can make it more bearable. Here's an example. A person could choose to fast between 8 p.m. and 8 a.m. They would need to finish their dinner before 8 p.m. and wait until 8 a.m. to eat breakfast. This allows the bulk of the fasting to be in your sleep, making it seamless. Next, we have the 16 to 8 method. During the 16 to 8 diet, you can drink water. However, you limit your intake of foods and calorie-containing beverages to a window of 8 hours per day. You abstain from food for the remaining 16 hours. It is believed to improve blood sugar control and enhance longevity. Popular 16 to 8 time windows include 9 a.m. to 5 p.m. This allows plenty of time for a healthy breakfast around 9 a.m., a standard lunch around noon, and a light, early dinner before 5 p.m. Others prefer to eat between noon and 8 p.m. This means you fast overnight and skip breakfast. You can still eat a healthy lunch and dinner before 8 p.m. Another method is fasting for 2 days a week. This is called the 5-to-2 diet. In a 7-day week, eat standard amounts of food for 5 days and reduce calorie intake on the other 2 days. During the 2 fasting days, people generally consume 600 calories. A study involving 107 obese women found that restricting calories twice weekly led to similar weight loss results. The study also found that this diet reduced insulin levels. Another method is alternate day fasting. Alternate day fasting is an extreme form of intermittent fasting. It may not be suitable for beginners or those with certain medical conditions. Alternate day fasting involves fasting every other day. A moderate form of this would be allowing consumption of 500 calories on each fasting day. However, an extreme form of alternate day fasting would be a complete avoidance of solid foods on fasting days. One study reports alternate day fasting is effective for weight loss and heart health. Researchers found that 32 participants lost an average of 5.2 kilograms over a 12-week period. Now we know the main types of intermittent fasting. Here's some tips on maintaining the fast. Stay hydrated. Make sure to drink lots of water throughout the day. This can help ensure you get enough electrolytes in the body. Rest and relax. Avoid strenuous activities on fasting days. Intense exercises will only lead to a larger appetite. This will make it harder to maintain your fast. Make every calorie count. Choose nutrient-dense foods that are rich in protein and fiber. Examples include beans, eggs, fish, and processed meats. Eat high-volume foods. Choose filling yet low-calorie foods. These include vegetables, oatmeal, and fruits with high water content, such as apples and melons. A drawback of intermittent fasting include headaches and lightheadedness. A 2020 report looked at studies of people undergoing intermittent fasting regimens. In the 4 studies, participants reported headaches. Fatigue and low energy is another drawback. Studies show people practicing various methods of intermittent fasting experience fatigue. Low blood sugar related to intermittent fasting can cause you to feel tired and weak. Overall, there are many ways to do intermittent fasting. And there is no single plan that will work for everyone. If you intend to lose weight, try it and see the results. That will be all from us. Please make sure you like and subscribe for more health content. Welcome to Healthy Habits. If you have been looking to shed off that frustrating belly fat, look no further. Today's video will include foods that promote fat burning throughout your body. Here's the best foods that burn belly fat. First, we have avocado. You may not know it, but avocado is a superfood. Incorporating an avocado into your diet may do your waistline some good. You could even consider the avocado as nature's keto starter, since studies show it helps your body burn fat for fuel. It's rich in monounsaturated and oleic fatty acids, which can reduce abdominal fat. Also, avocados are nutrient-dense and rich in fiber and healthy fats, which may help reduce inflammation and your risk of heart disease. Second, we have grapefruit. Incorporating grapefruit into your daily diet can actually hasten weight loss. Grapefruit is one of the lowest calorie fruits with 52 calories a serving. The sugar content in grapefruit is minimal. And what grapefruit lacks in calories, it makes up for in water. Its high water content can contribute to your daily water intake, which is integral for weight loss. Grapefruits have high fiber content, which is linked to longer feelings of fullness. This is imperative if you are trying to lose belly fat. A study was taken on grapefruit intake of obese people. It found that those who ate half a grapefruit before their normal meals lost more than 2.5 pounds on average than those who did not. Also, studies found that participants' waist sizes decreased when they added grapefruit to their diet. Next, we have cucumber. Since cucumber is very low in calories, it can aid in burning fat effectively. When consumed often, it can help cut down belly fat. Due to its high water and fiber content, a cucumber diet could help you detox, improve metabolism, and help with problems like constipation, water retention, and bloating. One study including 3,628 people found that eating foods with high water and low calorie contents was associated with a significant decrease in body weight. Next, we have salmon. Salmon is high in omega-3 fatty acids. This helps reduce pain and inflammation throughout the body. Weight gain is linked with increased inflammation in the body. Inflammation makes weight loss more difficult. So in order to see more effective results, stocking up on anti-inflammatory foods is beneficial for a decrease in belly fat. A 3 ounces portion of salmon provides around 20 grams of protein. Protein will help you build lean muscle as well as burn body fat. Lean protein has the highest thermogenic effect on the body. This makes it valuable because your body burns a lot of calories breaking it down. Next, we have barley. Research shows the fiber content in the barley improves your metabolism, which may help with weight loss because fiber takes longer for your body to digest. It can help you feel fuller and avoid overeating. As a result, it leads to fewer calorie consumption and gradual weight loss. Additionally, the cholesterol-lowering nature of barley is also beneficial in the long run. Next, we have pomegranate. Pomegranate has polyphenols antioxidant content, which helps burn fat and increase metabolism. Pomegranate has anti-inflammatory properties, antioxidants, and fiber. This combination of nutrients can help to lose belly fat. So, it is ideal to drink a cup of pomegranate juice to start off your day. Finally, we have eggs. Eggs are low in calories. One large egg contains only 74 calories. However, eggs are incredibly nutrient-dense and filling, mainly because of their high protein content. High-protein foods help reduce appetite and increase fullness. Additionally, eggs boost your metabolism. Eggs contain a good balance of all of the essential amino acids that your body needs. This means your body can use the protein in eggs for maintenance and metabolism. Eating a high-protein diet has been shown to boost metabolism by up to 100 calories a day. Incorporating eggs into your diet is very easy. They are cheap, widely available, and can be prepared within minutes. If you have been looking to shed off that frustrating belly fat, the foods listed in this video will be of great help. Incorporating these superfoods into your diet, whilst remaining active and burning calories, will help you lose weight. That's been all from Healthy Habits. Make sure to like, share, and subscribe for more healthy content. Welcome to Healthy Habits. Today, we will be talking about foods to avoid if you are trying to lose belly fat. Here's the foods to avoid if you're trying to get a flat belly. At number 1, we have alcohol. High alcohol intake may lead to inflammation and excess weight gain. This is because alcohol makes it harder for your body to access stored fat for energy. When you drink alcohol, the liver burns alcohol instead of fat. The body considers alcohol as waste. Therefore, when someone drinks, it metabolizes it, and other nutrients such as fat will be pushed aside. In addition, alcohol is calorie-dense. One beer contains 150 calories, and if you down several in one sitting, you can end up with serious calorie overload. Beer is an empty calorie. These are very quickly digested by your body, which means they don't help you feel full for very long. This is an easy way to consume excess calories, which leads to weight gain. Similarly, next we have carbonated drinks. Sodas provide empty calories that lead to bloating and weight gain. 500 milliliters of Coke contains 210 calories. These calories do not fill you up and can lead to overeating. There are high amounts of sugars in sodas. The liver is unable to process all of it, so it gets stored as fat. The sugars can also cause a sharp spike in your body insulin levels. Regular consumption of sodas can lead to diabetes, digestive disorders, and thyroid problems. Next we have fruit juices. Fruit juice sounds like a healthy alternative. However, it is a major source of unwanted sugars in your body. Processed fruit juices are a no-go as they contain chemicals and sugars. Fruit juice contains fructose, which if consumed in excess can cause thyroid problems and insulin imbalance. In addition, fruit juice may spike your blood sugar levels and increase your appetite, which over time can contribute to weight gain. Next we have salty snacks. Salt makes your body retain more excess water. If you consume salted chips, nuts, pickles, biscuits, and similar processed foods daily, chances are you are exposing your gut to more salt than it can digest. A diet high in salt leads to belly fat and thyroid problems. Next we have bakery products. Most bakery products are high in trans fats. Trans fats are added to processed foods to increase their shelf life. Trans fat has been clinically proven to cause weight gain, especially abdominal fat. The consumption of trans fats can lead to chronic inflammation. Bread, packaged cakes, and biscuits are high in sugars and trans fats. If you love bakery goods, try to find homemade suppliers. Homemade products often contain zero trans fats. Similarly to bakery products, frozen snacks are high in trans fats. Living a busy life takes its toll. Most people's diets depend on ready-made foods which are microwaved. Frozen nuggets, fries, fish fingers, pizzas, and many more. These can all lead to increased belly fat due to their high trans fat rate. Next we have processed meats. Processed meats such as sausages, salami, ham, hot dogs, and bacon are processed with trans fats to increase their shelf life. Additionally, these foods contain excess salt to add to their taste. This can lead to bloating. These foods are also higher in calories due to the high amounts of added sugar and fat in them. Finally, We have dairy products. If you are trying to lose belly fat, cut down on dairy products. Some people suffer from lactose intolerance without knowing it. The symptoms are similar: gas and bloatings. Swap out cow milk for other alternatives. Try to limit how much cheese and yogurt you consume. Your belly will thank you through better digestion and the loss of stubborn belly fat. Excessively eating any of these foods mentioned in this video may contribute to weight gain, especially belly fat. Eat in moderation and have a balanced diet to avoid increased belly fat. Thanks for watching Healthy Habits. Make sure to like, share, and subscribe for more health content. Welcome to Healthy Habits. Today, we will be talking all about cholesterol. Before we begin, we need to understand the distinction between good and bad cholesterol. There are two types: high-density lipoprotein HDL and low-density lipoprotein LDL. HDL is considered good cholesterol, while LDL is considered bad. This is because HDL carries cholesterol to your liver, where it can be removed from your bloodstream before it builds up in your arteries. LDL takes cholesterol directly to your arteries. This can result in a plaque buildup that can cause heart attack and strokes. Now we know the difference. Let's begin discussing the foods that lower cholesterol levels. First, we have oats. An easy first step to lowering your cholesterol is having a bowl of oatmeal for breakfast. It gives you 1 to 2 grams of soluble fiber. Soluble fiber found in oats helps to reduce the absorption of cholesterol into your body. Current evidence suggests daily oatmeal intake can lower cholesterol in 5 to 6 weeks. Next, we have beans. Beans are especially rich in soluble fiber. They also take a while for the body to digest, meaning you feel full for longer after a meal. They range from kidney beans to lentils, garbanzo, and beyond. Beans are a very versatile food. A cup of beans contains about 4 grams of cholesterol-lowering fiber. Studies show 1 portion of beans a day over a 6-week period was able to lower cholesterol by 5%. Next, we have okra. The high fiber content is good for controlling cholesterol. Researchers have found that a gel in okra called mucilage can help lower cholesterol. This is done by binding to it during digestion. This helps cholesterol leave the body through stool. Next, we have avocado. Avocados are a good source of nutrients as well as monounsaturated fatty acids. Consuming avocados can regulate levels of HDL cholesterol and LDL cholesterol. 1 cup, or 150 grams, of avocado contains 14.7 grams of monounsaturated fats, which can reduce cholesterol levels and lower the risk of heart disease and strokes. Next, we have olive oil. Olive oil is packed full of beneficial antioxidants that can lower your bad LDL cholesterol, while leaving your good HDL cholesterol untouched. This makes olive oil a healthier alternative when cooking and frying. Next, we have pears. Pears are rich in pectin, a soluble fiber which is also found in oats and beans. Pectin helps to reduce cholesterol absorption. It helps to lower LDL cholesterol as well. 1 pear contains approximately 3 grams of soluble fiber. Next, we have fish. Fatty fish is the best type of fish for lowering cholesterol because of its high levels of omega-3 fatty acids, which can reduce blood pressure and risk of developing blood clots. Examples include salmon, tuna, mackerel, sardines. Omega-3 fatty acids don't affect LDL cholesterol levels, but may help lower triglycerides and increase HDL, the good cholesterol. Next, we have nuts. Nuts are a good source of unsaturated fats, which can help lower LDL cholesterol levels. Nuts are also rich in fiber, which helps keep the body from absorbing cholesterol. Examples include almonds, hazelnuts, peanuts, and pecans. These may reduce your risk of heart disease. Avoid salted or sugar-coated nuts. These add unnecessary sodium and calories. All foods mentioned are beneficial for heart health. They are a source of soluble fiber and monounsaturated fats, which are imperative if trying to lower cholesterol or trying to minimize risk of heart disease. Thanks for watching. Make sure to like and subscribe for more content from Healthy Habits. Welcome to Healthy Habits. As we all know, eye health is important. That is why in today's video we'll talk about which foods benefit your vision. Here is foods for perfect vision. At first we have red peppers. Bell peppers give you the most vitamin C per calorie. That's good for the blood vessels in your eyes. Science suggests it could lower your risk of getting cataracts. Brightly colored peppers also have eye-friendly vitamins A and E. Next we have fish. Fish can be a great food to consume for eye health. Salmon and other fish have omega-3 fatty acids. These are healthy fats. Omega-3 fatty acids can contribute to visual development and the health of the retina. Low levels of these fatty acids have been linked to dry eyes. Symptoms of dry eyes include itchy and sore eyes. Your eyes may also look red and be more watery than usual. Next we have sweet potatoes. Orange-colored vegetables like sweet potatoes are high in beta-carotene, a form of vitamin A that helps with night vision. It also helps your eye's ability to adjust to darkness. Eating foods rich in beta-carotene, such as sweet potatoes, may help prevent a special type of blindness known as xerophthalmia. Similarly to sweet potatoes, next we have carrots. Carrots are well known to be good for eye health, like sweet potatoes. Carrots are high in beta-carotene. Beta-carotene helps the surface of the eye and can also help prevent eye infections and other serious eye conditions. Next we have kale. Kale is known as a superfood because it contains so many important vitamins, nutrients, and minerals. It's extremely good for eye health. Kale has the antioxidants lutein and zeaxanthin. These nutrients may help to prevent serious eye conditions such as cataracts. Lutein and zeaxanthin aren't made in the body, so you have to incorporate them into your diet. A 100-gram serving of kale contains 11.4 milligrams of lutein, which is higher than the recommended 10 milligrams per day. Next we have oranges. Oranges and other citrus fruit contain vitamin C, which is key for eye health. The vitamin, found mainly in fresh fruits and vegetables, contributes to healthy blood vessels in your eyes. It can combat the development of cataracts. Next we have almonds, like other nuts and seeds, are generally good for eye health. Almonds contain vitamin E. This vitamin guards against unstable molecules that target healthy tissue. Consuming high amounts of vitamin E can help prevent age-related macular degeneration as well as cataracts. Age-related macular degeneration usually affects older people. The condition affects the central part of the retina, impacting the middle part of people's vision. Although it doesn't cause total sight loss, it can make everyday activities such as reading difficult. This is why it is important to have a diet that includes all vitamins and high in beta-carotene. Next we have eggs. Eggs are a great food to eat for eye health. The yolks contain vitamin A, lutein, zeaxanthin, and zinc, which are all vital to eye health. Vitamin A safeguards the cornea. The cornea is the surface of the eye. Lutein and zeaxanthin lower the chance of getting serious eye conditions like age-related macular degeneration and cataracts. Zinc contributes to the health of the retina. Zinc also helps eye's ability to adjust to darkness. Eggs are versatile and affordable, making it a must-buy to improve eye health. Similarly, next we have dairy products. Dairy products such as milk and yogurt can be good for the eyes. They contain vitamin A as well as zinc. These help with night vision as well as the prevention of cataracts. Dairy from grass-fed cows provides the most benefits. All these foods have massive benefits for eye health. Maintaining a diet high in antioxidants will prevent the development of serious eye conditions and ensure your eyes work their best. Thanks for watching. Make sure to like and subscribe for more content. Welcome to Healthy Habits. In today's video, we will be talking about mental health. Mental health is a normal part of human existence. In fact, 1 in 4 people will be affected by a diagnosable mental illness in their lifetime. Unlike physical conditions, the hidden nature of mental illness makes it difficult to spot early and prevent. Mental illness is a condition that impacts a person's thought process, emotions, behavior, and the way they interact with others. There are many types of mental health illnesses. ranging from anxiety disorder, depression, bipolar disorder, post-traumatic stress disorder, schizophrenia, eating disorders, disruptive behavior, and more. In today's video, we will be discussing some of the early signs and symptoms you must not ignore. First, we have feeling anxious or worried. We all get worried or stressed from time to time, but perpetual anxiety could be the sign of a mental health disorder. If the worry or anxiousness is constant, it could begin to interfere with regular daily activities. Symptoms of anxiety may include heart palpitations, dizziness, sweating, shortness of breath, headache, trembling, restlessness, or a racing mind. A big event or a buildup of smaller stressful life situations may trigger excessive anxiety. If these feelings are constant, that is an early sign you are going through a mental health disorder. Next symptom is sleep problems. We all have nights when it's hard to fall asleep or wake up. Most sleep problems sort themselves out, but longer stretches of bad sleep can be a sign of a mental health disorder. Consistent sleep problems can be caused by specific mental health disorders. Anxiety can cause your thoughts to race, which can make it hard to sleep. Depression can lead to oversleeping, sleeping late or a lot during the day. PTSD can cause nightmares or night terrors. These may wake you up and/or make you feel anxious about falling asleep. The next early symptom is mood swings. Whilst everyone experiences mood swings to a certain degree, extreme mood swings can be characteristic of mental illnesses. Someone with emerging mental health illness may have mood swings. They'll have their lows, then feel okay. Sudden and dramatic changes in mood, such as extreme distress or anger, can be a symptom of mental illness. The next early symptom is lack of hygiene. One of the worst things about mental illness is how it seeps into so many parts of your life, affecting even the most mundane things, like showering, brushing your teeth, doing laundry, or brushing their hair. Emerging mental health issues make keeping track of days difficult, and due to low energy, keeping up with hygiene is challenging. The next early symptom is being withdrawing from life. Especially if this is a major change, could indicate a mental health disorder. A person who is socially withdrawn removes themselves from encounters and interactions with others. Reasons people may choose to withdraw from others include anxiety, fear, depression, and shame. It can be a reflection of an underlying mental health condition. The next early symptom is substance abuse. Abusing substances like alcohol or drugs can be a sign of emerging mental health illness. While the substances may cause a temporary relief from the emerging symptoms, abusing those substances can lead to dependence upon them. If you notice yourself using substances as a coping mechanism, this could be a red flag and must not be ignored. The next early symptom is a change in appetite. Mental health disorders can affect appetite and change eating patterns. It can cause us to eat unhealthily, eat more than usual, and it can lead to a loss of appetite. If you notice significant appetite changes, this could be a signal you are going through a mental health disorder. The last symptom we will mention in this video is concentration issues. Lack of focus when giving or receiving direction can result in misunderstandings at home, work, or school. You may find that you can't focus on a task, as other thoughts are clouding your mind, distracting you from your intended job and leaving it incomplete or below expectations. If a reduced concentration span remains consistent, you may be going through mental health struggles. Now that you are aware of some of the early signs to watch out for, we will be discussing how best to deal with these signs in our next video to help stop them from getting worse. Did any of these signs resonate with you? Share your thoughts in the comments section below, and as always, make sure to like, share, and subscribe for more content about blood pressure and hypertension. We will mention the main causes of high blood pressure and how to avoid this condition. So, here are the main reasons that you have a high blood pressure. High blood pressure usually develops over time. It can happen because of unhealthy lifestyle choices, such as not getting enough regular physical activity. Being active lowers your blood pressure. Regular exercise makes the heart stronger, A stronger heart can pump more blood with less effort. As a result, the force on the arteries decreases. This lowers blood pressure. The next reason is smoking. Smoking a cigarette instantly raises your blood pressure and pulse. Repeated spikes in your blood pressure can have long-term effects. It can damage the walls of your arteries and put you at higher risk of many serious heart conditions. Smoking can increase the buildup of plaque in your arteries, which can lead to heart attacks and strokes if left untreated. The next reason is alcohol intake. There is a clear link between drinking too much alcohol and having high blood pressure. Alcohol relaxes the blood vessels and widens them. This expansion of blood vessels can cause an increase in blood flow, which leads to an elevation in blood pressure. Alcohol consumption can stimulate the release of adrenaline, which can further elevate blood pressure in the short term. If you suffer from high blood pressure, healthcare professionals may advise you to reduce the amount of alcohol you drink. The next reason is stress. We all go through stress, whether it is financial problems, loss of job, or work deadlines. Your body reacts to stress by releasing adrenaline into the blood. This makes your heart beat faster and your blood vessels narrower, raising your blood pressure in the short term. Short spikes in blood pressure can cause heart attacks or strokes, and can damage the heart and the kidneys over time. The next reason is high salt intake. Kidneys filter 200 liters of fluids each day. They pull toxins and unwanted fluids from cells, then send them to the bladder. Eating too much salt can make it harder for kidneys to remove fluids, which builds up in your system and increases your blood pressure. Over time, excessive salt intake leads to high blood pressure, which narrows the blood vessels. Blood and oxygen flow to key organs decreases. The heart compensates and tries harder to pump blood throughout the body, which further increases blood pressure. The next reason is being overweight. Being overweight forces your heart to work harder to pump blood around your body, which can raise your blood pressure. Losing a few pounds will make a big difference to your blood pressure and overall health. The next cause of high blood pressure could be medications. An example is ibuprofen. Ibuprofen can cause worsening of existing hypertension or development of high blood pressure, putting greater stress on your heart and kidneys. It can also raise your risk of heart attacks, especially in higher doses. Some causes can't be prevented, such as genetics. Genes likely play some role in high blood pressure, heart disease, and other related conditions. If someone has family members with hypertension, they have an increased risk of developing the condition. High blood pressure can run in families because of shared genes, environments, and lifestyle habits. The risk increases even more if an individual with a genetic link to hypertension also engages in unhealthy lifestyle choices. Another cause that can't be prevented is old age. High blood pressure, or hypertension, is a major health problem that is common in older adults. The chance of having high blood pressure increases. As you age, your body's vascular system changes with age. Arteries get stiffer, causing blood pressure to go up. This can be true even for people who have healthy habits. According to research, this condition impacts 70% of Americans age 65 plus. Our final reason is high caffeine intake. Caffeine may cause a short, but dramatic increase in your blood pressure, even if you don't have high blood pressure. Researchers believe that caffeine blocks a hormone that helps keep your arteries widened, while others think caffeine causes your adrenal glands to release more adrenaline, which causes your blood pressure to increase. People who regularly drink caffeinated beverages have a higher average blood pressure than those who drink none. If you have high blood pressure, ask your doctor whether you should limit your caffeine intake. Overall, many factors can cause high blood pressure. Some can be preventable, such as alcohol and smoking, while others like genetics and old age can't be prevented. Nevertheless, living a healthy lifestyle gives you the best platform to avoid heart diseases and high BP. As always, thanks for watching. Make sure to like, share, and subscribe for more content. Welcome to Healthy Habits. In today's video, we will be talking about blood pressure and hypertension. We will be mentioning alternative methods that help lower blood pressure levels. So, here's how to treat high blood pressure. First, we have exercise. For those who have high blood pressure, regular physical activity can bring blood pressure down to safer levels. Exercise lowers blood pressure by reducing blood vessel stiffness so blood can flow more easily. Also, regular exercise makes the heart stronger. A stronger heart can pump more blood with less effort. As a result, the force on the arteries decreases. So if you're looking for an effective way to lower your blood pressure, try aerobic exercises, like jogging. Next, we have smoking. Quitting smoking is a great first step for lowering your blood pressure. Reports state in as little as 1 day after quitting smoking, a person's blood pressure begins to drop. When you stop smoking, your arteries and blood vessels start widening. Because your body is no longer exposed to the toxins present in nicotine, this means the blood can easily travel through vessels, gradually reducing the risk of high blood pressure. Next, we have limiting alcohol intake. Drinking too much alcohol can raise blood pressure to unhealthy levels. Alcohol relaxes and widens blood vessels. This expansion of blood vessels leads to an increase in blood flow. This raises blood pressure. Reducing alcohol intake will be beneficial, as it will allow your blood vessels to function efficiently. Next, we have improving sleep schedule. Poor sleep quality can contribute to hypertension. During sleep, your blood pressure goes down. Having sleep problems means your blood pressure stays higher for a longer period of time, which leads to risks for heart disease and stroke. Sleep experts recommend adults should get more than 7 hours of sleep a night for improved overall health. The next method is reducing salt intake. Even a small reduction of sodium in the diet can improve heart health and reduce high blood pressure. Salt encourages your body to retain fluid, which can increase the fluid volume of your blood and raise blood pressure. Reducing salt intake can make it easier for kidneys to remove fluids, which can reduce blood pressure levels significantly. The next method is losing extra pounds. If you are overweight, losing weight will lower your blood pressure levels. This is because your heart doesn't have to work as hard to pump blood and oxygen around your body. Losing weight reduces stress to your heart and blood vessels, reducing your risk of further complications. Next method is reducing stress levels. Long-term stress may contribute to high blood pressure. Your body reacts to stress by releasing adrenaline into the blood. This makes your heart beat faster and your blood vessels narrower, which raises your blood pressure. Plan your day and focus on your priorities. Allow enough time to get done what needs to be done. Avoid stress triggers. Make time to relax. Have a structured plan. These can all contribute to lowering stress levels, which will help improve your overall health. The next method is eating a healthy diet. Eating healthy aids weight loss, which lowers blood pressure. More specifically, an example of an eating plan that helps control blood pressure is the dietary approaches to stop hypertension diet. Foods in the DASH diet are rich in potassium. Potassium in the diet can lessen the effects of sodium on blood pressure. The best sources of potassium are foods such as fruits and vegetables. Examples include avocados, bananas, and oranges. The final method is getting support. Supportive family and friends are important to good health. They may encourage you to take care of yourself, improve your overall mood, or start an exercise program with you to keep your blood pressure low. Overall, high blood pressure is a serious condition that can cause long-lasting damage to the heart and blood vessels over time. There are many methods to lower your blood pressure. Whether it is improving sleep schedule or improving diet, make sure to stay active and keep spirits high. If you find any of this helpful, make sure to like, share, and subscribe for more Healthy Habits content. Welcome to Healthy Habits. In today's video, we will be talking all about diabetes. The number of people with diabetes is higher than it has ever been. We would like to inform you about the early signs and symptoms you must not ignore. First, we will be talking about different types of diabetes. If you have type 1 diabetes, your pancreas makes little to no amounts of insulin. Insulin helps blood sugar enter the cells in your body for use as energy. Without insulin, your body will break down its own fat and muscle. Type 2 diabetes occurs when the body doesn't produce enough insulin to function properly, or the body doesn't react to insulin. This means glucose stays in the blood and isn't used as fuel for energy. In diabetes type 2, the pancreas makes less insulin than used to, and your body becomes resistant. Type 2 diabetes is more common. It is often associated with obesity and tends to be diagnosed in older people. Due to increased obesity rates, type 2 diabetes is seen in all age groups. In today's video, we will be listing diabetes signs and symptoms to be aware of. If a lot of these symptoms relate to you, please see your doctor about getting your blood sugar tested. The first symptom is frequent urination. Frequent urination is a common diabetes symptom, as we are aware. Diabetes is a condition that causes your body to have trouble creating or using insulin. Insulin is a hormone that draws glucose, or sugar, into the cells to use as energy. If there is not enough insulin or it does not work efficiently, blood sugar builds up. Too much sugar in your blood is taxing on the kidneys, which work to reabsorb sugar into the bloodstream. When the kidneys can't reabsorb the sugars correctly, urination helps eliminate the glucose from the body. Early on, you may not notice that you're urinating more often. However, a key warning sign is if constant urination starts to wake you up from sleep and depletes your energy levels. The next symptom is constant feelings of dehydration. This is related to frequent urination. There is a use up of water in the body. Water is pulled from your tissues to help get rid of the extra sugar because you're losing a lot of water. You can feel very thirsty. Your brain tells you to drink more water to hydrate. In turn, this triggers more urination. The diabetes urine and thirst cycle will continue if your blood sugar levels are left imbalanced. The next symptom is increased hunger. This is known as polyphagia. Hunger and cravings are a frustrating side effect of high blood sugar levels, even after you eat. You may still feel very hungry. That's because your muscles aren't getting the energy they need from the food you eat. Your body's insulin resistance keeps glucose from entering the muscle and providing energy. Therefore, the muscles and other tissues send a hunger message, trying to get more energy into the body. This leads to our next symptom, fatigue. Fatigue and weakness may occur when the cells do not get enough glucose. When there is not enough insulin, or the insulin isn't working effectively, it means the sugar in our blood cannot get into our cells. Therefore, our cells do not receive the energy needed. If you feel tired during the day, despite having slept well, this could be an early symptom. The next symptom is blurry vision. In a person with diabetes, fluid moves in and out of the eyes due to high blood sugar levels. This can cause the lens of the eye to swell. Blurriness occurs because the lens is the part that focuses light onto the back of the eye. This is a short-term issue that tends to resolve when blood sugar levels fall. The next symptom is increased amount of illnesses. The effects of diabetes make it harder for your body to fight off infections. Research shows that people with diabetes have more frequent illnesses, like flu, pneumonia, and skin infections. Extra sugars in the blood break down into a compound called decarbonyl, weakening your body's defenses. Also, bacteria flourishes when there are high levels of glucose in the blood, making it even harder for a weakened immune system to fight off the invading bacteria. The next symptom is slower healing of wounds. When blood is thick with high blood sugar, it takes longer for white blood cells to get to the wound site and fight off infection, delaying the healing process. Diabetes may also affect circulation, causing blood to move more slowly, which makes it more difficult for the body to deliver nutrients to wounds. This causes the injuries to heal slowly, or may not heal at all. The next symptom is weight loss. You may be eating more but still losing weight, since your body isn't getting energy from food. It turns to muscles and fat. It starts to break them down in order to create energy. This causes a reduction in body weight. The next symptom is patches in skin. A common symptom of diabetes is a condition called acanthosis nigricans. Some of your skin may turn brown or black. It usually shows up in the armpits and neck. It can be a result of the insulin resistance associated with diabetes. Finally, having numb or tingling hands or feet is a symptom of diabetes. High blood glucose levels can damage the small blood vessels that supply the nerves in your body. This stops essential nutrients reaching the nerves. As a result, the nerve fibers can become damaged, and they may disappear. Overall, diabetes is becoming more and more common in today's society. A healthy diet, regular physical activity, and maintaining a normal body weight are ways to prevent or delay the onset of diabetes. Over time, diabetes can damage blood vessels in the heart, eyes, kidneys, and nerves. This is why it's important to spot early signs and symptoms. If many of these symptoms relate to you, take a blood glucose test to help diagnose and monitor diabetes. Thanks for watching. Make sure to like, share, and subscribe for more healthy habits content. Welcome to Healthy Habits. In today's video, we will be talking all about diabetes. The number of people with diabetes is higher than it has ever been. In today's video, we will be looking at the ways to prevent and reduce diabetes risk. First, we will be talking about different types of diabetes. If you have type 1 diabetes, your pancreas makes little to no amounts of insulin. Insulin helps blood sugar enter the cells in your body for use as energy. Without insulin, your body will break down its own fat and muscle. Type 2 diabetes occurs when the body doesn't produce enough insulin to function properly, or the body doesn't react to insulin. This means glucose stays in the blood and isn't used as fuel for energy. In diabetes type 2, the pancreas makes less insulin than used to, and your body becomes resistant. Type 2 diabetes is more common. It is often associated with obesity and tends to be diagnosed in older people. Due to increased obesity rates, type 2 diabetes is seen in all age groups. First, we have regular exercise. Doing physical activity regularly may help prevent diabetes. Exercise increases the insulin sensitivity of your cells, meaning that you need less insulin to manage your blood sugar levels. Physical activity also helps control blood sugar levels and lowers your risk of heart disease and nerve damage. Many types of physical activity have been shown to reduce insulin resistance and blood sugar levels. These include aerobic exercise, high-intensity interval training, and strength training. Next, we have increasing water intake. Sticking with water as your drink of choice will help you limit beverages that are high in sugar. Drinking water regularly may rehydrate the blood, lower blood sugar levels, and reduce diabetes risk. Water dilutes the amount of sugar in the bloodstream. Sugary beverages like soda and fruit juices have been linked to an increased risk of diabetes. In contrast, increased water intake may lead to better blood sugar management and insulin response. The next method to lower diabetes risk is weight loss. Carrying extra weight may increase your risk of diabetes, in particular, visceral fat. Excess weight in your midsection and around your abdominal organs is associated with insulin resistance, inflammation, and diabetes. Losing weight could help the insulin you produce or the insulin you inject to work properly. In some cases, weight loss is enough to restore blood sugar to normal levels. The next method to lower diabetes risk is quitting smoking. Smoking has been shown to cause or contribute to many serious health conditions. Research links smoking to diabetes. Smoking may increase insulin resistance and inhibit insulin secretion. Studies have shown that insulin can start to become more effective at lowering blood sugar levels 8 weeks after a smoker quits. The next method is reducing carb intake. Your body breaks down carbs into small sugar molecules, which are absorbed into your bloodstream. The resulting rise in blood sugar stimulates your pancreas to produce insulin. Reducing carb intake can help stabilize blood glucose. It may also counteract some other effects of diabetes. Replacing carbs with foods that have less of an effect on blood sugar may reduce your risk. Next, we have reducing alcohol intake. Drinking excessive amounts of alcohol has been linked to an increased risk of developing diabetes. Alcohol interferes with your blood sugar levels. It can also increase your chances of gaining weight and can make losing weight more difficult. There's nothing wrong with a little alcohol in moderation. But it's important to avoid drinking excessive amounts of alcohol or drinking on a very regular basis. Finally, we have healthy eating. Being overweight or obese puts you at greater risk of developing diabetes. A diet that's low in fat, sugar and salt, and contains lots of fruits and vegetables will reduce your cholesterol levels and can support you in losing weight. There is evidence that eating a low-calorie diet can help with symptoms of diabetes. A healthy diet will also help you manage your blood sugar level. Overall, diabetes is becoming more and more common in today's society. A healthy diet, regular physical activity, and maintaining a normal body weight are ways to prevent or delay the onset of diabetes. Eating the right foods and adopting other lifestyle behaviors that promote healthy blood sugar and insulin levels will give you the best chance of avoiding diabetes. Thanks for watching. Make sure to like, share, and subscribe for more healthy habits content. Welcome to Healthy Habits. In today's video, we will be talking all about insomnia. Insomnia is a medical condition characterized by difficulty falling asleep or staying asleep. This can result in daytime fatigue, difficulty concentrating, and other negative effects on a person's overall well-being. Insomnia can be a temporary or chronic condition and may have various causes. In today's video, we will be going through all the main causes of insomnia. So, whether you're someone who battles insomnia or you're simply curious to learn more, stay tuned. The first cause could be stress and anxiety. High levels of stress and anxiety are among the most common causes of insomnia. Worries, racing thoughts, and a general sense of unease can make it difficult to relax and fall asleep. Cortisol, the primary stress hormone, can disrupt sleep patterns. Research states that high cortisol levels in the evening can cause a lack of sleep. The next cause of insomnia is depression. Individuals with depression often experience changes in their sleep patterns. They may have difficulty falling asleep, waking up frequently during the night, or waking up too early in the morning. Changes in brain chemistry associated with depression can affect sleep patterns. The next cause of insomnia is excessive alcohol intake. Alcohol can have a sedative or stimulant effect. Some people who drink frequently develop a tolerance to the sedative effects of alcohol. Dependence on alcohol is associated with a higher rate of sleep disturbance and insomnia. An estimated 36% to 67% of people with alcohol dependency experience insomnia. The next cause of insomnia is a high caffeine intake. Caffeine can have a disruptive effect on your sleep. Heavier caffeine consumption, compared with light or no caffeine consumption, is associated with higher insomnia symptoms and daytime sleepiness. Caffeine is a stimulant that keeps your body awake and alert. It works by blocking sleep-promoting receptors in your brain called adenosine receptors. This is why excessive intake can promote insomnia. The next cause of insomnia could be the food you eat. What you eat can, directly and indirectly, affect your quality and duration of sleep. Certain foods or components in foods can disrupt your internal clock. If continued, this can cause insomnia. Foods high in fat and sugar, such as cookies, cakes, and sweets, can interrupt healthy sleep patterns, especially when eaten close to bedtime. The high sugar content can raise your blood sugar levels, which leads to an increase in insulin. This causes a chain of events that results in poor sleep. The next cause of insomnia could be pregnancy. Insomnia during pregnancy is completely normal. Research suggests that around 70% of pregnant people experience insomnia. Pregnant people may start to have trouble sleeping as early as the first trimester. Pregnancy insomnia is caused by rapid changes in reproductive hormone levels and the symptoms this causes. Symptoms include nausea, vomiting, and increased urination. All of this disrupts the body's regular sleep and wake cycles. The next cause of insomnia could be physical illness and pain. Almost any condition that causes pain can disrupt sleep by making it harder to lie comfortably in bed. Dwelling on pain when sleepless in bed may amplify it, increasing stress and sleeping problems. Other types of physical illness or pain, such as after a surgery, including those affecting the respiratory or nervous system, may pose challenges to sleep that can culminate in short-term or chronic insomnia. Finally, we have old age. As people age, they may experience changes in their sleep patterns. This includes lighter sleep, more frequent awakenings during the night, and a tendency to wake up earlier in the morning. Insomnia occurs in 30 to 48% of older adults. Elderly people have less sleep efficiency and are often more sensitive to symptoms of insomnia due to chronic health conditions, social isolation, and an increased use of prescription drugs. For elderly people in managed care settings, a decrease in daylight exposure can affect their body clock. Overall, it's important to note that insomnia can result from a combination of these factors, and identifying the specific causes for an individual can sometimes be complex. If you are experiencing persistent insomnia, it's advisable to consult with a healthcare professional. Stay tuned for our next video. We will be mentioning remedies to help cure insomnia, but for now, thanks for watching. Make sure to like, share, and subscribe for more healthy habits content. Welcome to Healthy Habits. In today's video, we will be exploring some effective cures and remedies to help you finally conquer those restless nights. We'll be sharing tips and strategies backed by science, as well as some approaches that have worked wonders for many. Whether you're struggling with occasional sleepless nights or battling chronic insomnia, this video is here to provide you with solutions to help you achieve the peaceful sleep you deserve. What is insomnia? Insomnia is a sleep disorder characterized by persistent and recurring difficulties in initiating and maintaining sleep. This can result in daytime symptoms such as fatigue or difficulty concentrating. Insomnia can be a temporary or chronic condition. Here's a few solutions that can stop this condition. Regular exercise can be an effective remedy for insomnia. Physical activity helps regulate the body's internal clock, known as the circadian rhythm. Exercising at consistent times during the day reinforces your circadian rhythm, making it easier to fall asleep and wake up at desired times. Regular exercise can be a valuable method to managing insomnia. It helps reduce stress, improve sleep quality, and enhance overall well-being. Reducing caffeine intake can be an effective strategy for alleviating insomnia. Caffeine stimulates the central nervous system, increasing alertness and reducing feelings of fatigue. By reducing caffeine intake, you allow your body to wind down and relax, making it easier to fall asleep. Caffeine increases the time it takes to fall asleep. By cutting back on caffeine, you're likely to have a smoother transition into sleep. Avoid caffeine in the evening, as it can affect sleep for up to 6 hours after consumption. Opt for caffeine-free beverages in the late afternoon and evening to avoid disturbances to sleep. Limiting screen time, especially before bedtime, can be an effective strategy for managing insomnia. Screens emit blue light, which can interfere with the body's natural production of melatonin, a hormone that regulates the sleep cycle. Excessive blue light exposure in the evening can disrupt your body clock and make it harder to fall asleep. If you must use screens in the evening, enable night mode or use blue light filters on your devices. This reduces the blue light emitted. Dietary adjustments play a significant role in alleviating insomnia. Eating high sugar or high carb meals, especially close to bedtime, can cause blood sugar spikes and crashes during the night, potentially leading to nighttime awakenings. Consuming large or spicy meals close to bedtime can cause discomfort and indigestion, making it difficult to fall asleep or stay asleep. Light and easily digestible meals in the evening can improve sleep comfort. Stress management is a powerful and effective approach to alleviate insomnia and improve sleep quality. Chronic stress and anxiety are common contributors to sleep difficulties. And by addressing stress, you can significantly enhance your ability to sleep well. Chronic stress often leads to heightened anxiety and racing thoughts, which can make it difficult to relax and fall asleep. Techniques such as deep breathing or meditation can help relax the body. This physical relaxation can make it easier to transition into sleep. If stress and anxiety are overwhelming and persistent, consider consulting a mental health professional. They can provide guidance and strategies for managing stress. Other relaxation methods include listening to relaxing sounds. This can be a helpful tool for improving sleep quality. The soothing and calming effects of music can promote relaxation, reduce anxiety, and create a more peaceful sleep environment. Nature's sounds are the most popular. Sounds such as ocean waves, rainfall, forest streams, or chirping birds can create a peaceful atmosphere conducive to sleep. You can find soundtracks from our Healthy Habits channel live streams. Optimizing your sleep environment is the next step for improving sleep quality. A comfortable and sleep-conducive environment can greatly improve your ability to fall asleep and stay asleep. Ensure your mattress and pillows are comfortable and provide proper support. Ensure that your bedroom is as dark as possible. Light can interfere with the production of melatonin, the sleep hormone. Consider using blackout curtains or an eye mask if necessary. Keep your sleep environment tidy and free of clutter. A clean and organized space can contribute to a sense of calm. If your insomnia is chronic, severe, or not improving with self-help strategies, it's crucial to seek guidance from a healthcare professional or a sleep specialist. They can identify underlying causes and recommend appropriate treatments. Thanks for watching. Remember that not all remedies work for everyone, and it may take time to find the right combination of strategies. To effectively manage your insomnia, patience and persistence are key when addressing sleep issues. As always, like, share and subscribe for more Healthy Habits content. Here are 7 key facts about beetroot. 1 cup of beetroot contains 43 calories, 1.6 grams of protein, 9.6 grams of carbs, 6.8 grams of sugar, 2.8 grams of fiber, and 0.2 grams of fat. Beetroots help lower blood pressure. Beetroots are rich in inorganic nitrates, which helps cut risk of heart disease and strokes. Studies show that beetroots can reduce blood pressure by up to 3 to 10 millimeters. Beetroots helps increase exercise capacity. Studies suggest that nitrates enhance physical performance. Nitrates from beet juice help increase cardiorespiratory performance and improve muscle function. Nitrates open up your blood vessels, which increases blood flow and feeds oxygen to working muscle. A cup of beetroot could help you complete that extra kilometer in your morning jog. Beetroots has anti-cancer properties. The plant pigment that gives beetroot its color is betacenin, a powerful agent that helps suppress the development of some types of cancer, including bladder cancer.